Hello, guys. This is your online pharmacist. I hope you all are doing great or you all are doing well. We are meeting after so long, and I'm going to demonstrate a topic which is the most requested topic related to bones and joint disorders. As you know, a lot of people are suffering from bones and joint disorders nowadays due to the lack of nutrition and other factors we will discuss here later. So, the today's topic is related to bones and joints, and the chapter name is Gout and Hyperuricemia. This chapter is taken from Pharmacotherapy Handbook 7th edition. Its name is DePiro. What is gout? We will first discuss the definition of gout. The gout describes a disease spectrum including hyperuricemia, recurrent attack of acute arthritis. What does it mean? It is the gout term is a disease which is due to hyperuricemia. Hyperuricemia means that is increased uric acid in blood. This is due to increased uric acid in blood. Whenever the uric acid in our blood or the acidity of the blood increases, it causes a disease called gout. Gout may be an asymptomatic condition. Why? Because hyperuricemia is not most probably be detected in blood. With an increased serum uric acid concentration as the only apparent abnormality. A urate concentration we will discuss later, which is considered as abnormal and associated with increased risk of gout. Whenever there is an acute attack of gout or arthritis means the pain or inflammation in the bones is associated with gout. Why it happens? It happens due to the monosodium urate crystals. What are these monosodium urate crystals? These crystals accumulated in the synovial fluid. What is synovial fluid? Synovial fluid is found between two joints which are connecting the two joints and allow the movement of two joints. What are the causes? Please ignore the heading. It is some misalignment here. Hyperuricemia is an I have taught you asymptomatic condition. When it happens, there is an increased serum uric acid concentration. Whenever there is an increase in the uric acid in the blood and you have go for a test, then you will detect it by that's hyperuricemia. It is gout. It's the most abnormal or asymptomatic condition. Whenever the urate crystals greater than 7.0 milligram per deciliter can increase the risk of gout. Means if a person having a urate concentration less than 7.0, it's normal, no need to worry. But when it reaches 7.0 milligram per deciliter, then there is an increased risk of gout, means joint and bone disorder. What are the cause? Number one, the first cause is the uric acid concentration is increased. The second cause, cytotoxic drugs. Cytotoxic drugs are those drugs which causes an overproduction of uric acid. How it causes uric acid increases? It lies or break down the cellular matter. Which kind of cellular matter? Whenever the cell break down, a uric acid may also produced excessively whenever the nucleic acids in the tissues breaks down and causing or it is more common in myoproliferative and lymphoproliferative disorder. Myoproliferative disorder related to the whenever the blood cells multiply rapidly and causing a blood cancer or other types of cytotoxicity in the body. Cytotoxic drugs for treat these disorders can also result in overproduction of uric acid due to the lysis. Why it is so crucial? Because the patient suffering from autoimmune disorder like cancers, like a lymphoma, like myeloid disorders and other types of blood generative or autoimmune disorders, then it will most probably the cause of gout. What is the pathology? Pathology we will discuss in the next slide. It's very interesting. You must see the next slide. What is the pathophysiology? What is the pathophysiology of gout? Whenever we take food, whenever the food is intake inside the body, what happens? The cell will break down the food and convert it into an energy, and it will convert it into purines, and purines form uric acid because it is a byproduct of uric acid. Whenever there is a purine in the body, it results in results in formation of uric acid. What will the purines do? The purines from which uric acid is produced. Purine, what is purine? Purine is a body from which uric acid is produced. It originates from three sources. Dietary purines, either it will come from diet, either it come from conversion of tissues nucleic acid to purine nucleosides, and the de novo synthesis of purine bases. These are the three mechanisms from which purines are formed. The uric acid is originate from the dietary purines, number one. Number two, conversion of tissue nucleic acid to purine nucleotides. Number three, de novo synthesis of purine bases. These are the three sources from which purines are formed. Whenever there is excess purines in the body, it will cause an overproduction of uric acid. Whenever there is an overproduction of uric acid, that's known as hyperuricemia. Under excretion can also lead to hyperuricemia, and it affect the kidney, soft tissues of the joint, and other tissues like ear, knee, ankle, and other types of joints will be affected by this. What is tophi? Tophi or tofu are the urate deposits. It's very uncommon in gouty patients, and these are the very late or the very severe cases of hyperuricemia in which the tofu is seen. The most common sites of tophaceous deposits in patients with recurrent acute gouty arthritis are the base of the great toe. A person is suffering from gout must having pain, inflammation, redness, and swelling whenever it goes to bed, and they are the most common sign and symptoms which are appears at the great toe, helix of the ear, olecranon bursae, Achilles tendon, knees, wrist, and hands. What are the clinical presentations? How we recognize or how we check what we are suffering from gout? Number one, if we are suffering from pain, if a patient is suffering from swelling, fever, warmth, and inflammation at any joint, most especially the toe or the knee joint, then these are the most common clinical presentations. This is the most common and the most clinical presentation. If a person is sleeping or is going to bed and going to make a bed, then attacks commonly begin at night with a patient awakening from sleep with excruciating pain, the pain which is not bearable, and it leads to inflammation and redness. What is gout? These are all are the affected areas which are affected by gout due to the increased monosodium urate crystals deposition in the leukocytes of synovial fluid. How to diagnose gout? The most important. First, we have to take the medical history of the patient. Medical history will determine either the patient having a hyperuricemia or its uric acid is high or not. Physical examination of patients, either all the joints, all the bones are suffering or not. Blood test for uric acid, the leukocytes test or the blood test determines uric acid concentration. If the uric acid concentration is low or uric acid concentration is high, then the patient is checked either it is suffering from gout or not. Number 4, synovial fluid analysis. The synovial fluid analysis, like the sample of the synovial fluid is taken and the leukocytes are checked for the monosodium urate crystals deposition. If the test come positive, then the person is diagnosed with gout. Imaging test is the most expensive test, and it will shows the crystals and the structure of the crystals and the severity of the inflammation, and all the synovial fluid structural information is given. Other health conditions, like if the purine or the dietary purine is high, if the person is taking high amount of purine, or there's a nucleic acid depletion, or there's a nucleic acid breakdown in the cells, or if the person is suffering from another type of autoimmune disorders, then these are the common diagnostic tests. What is the treatment? What comes next, or what comes after we all have diagnosed, or we all diagnosed, patient is diagnosed? Then the treatment comes with NSAIDs, the dosage residence of non-steroidals, ibuprofen 800 milligrams a day, 4 times a day. Means 800 milligrams is given 4 times a day. Pyroxicam 20 milligram once daily. Naproxen is given 500 milligrams twice daily for 3 days. Phenoprofen is given 600 milligrams 3 to 4 times a day if a patient is suffering from gout. This is the chart which is the detailed pathophysiology and other clinical presentations, or what are the treatment and other pathological conditions we'll discuss. This is the treatment algorithm of acute gouty arthritis and says non-steroidal anti-inflammatory drug, and we will discuss in the next part. Thank you. That's all for today. Please like, subscribe and share and support. Thank you.